Hello everyone. Greetings everybody. I am Geet from Beautiful Spotless Skin Team. I am sure all of you must be keeping good health. You must all have come across people, especially women with brown colored patches on their face. They seem like freckle-like spots forming a large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities, revealed that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. The heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone more susceptible to pigmentary disorders. It occurs mainly in women, 90% and 10% males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as a sign of aging and often misunderstood skin condition. Melasma sufferers has been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in the treatment. To avoid all these hassles and to keep you informed, today we are here to know about management of melasma from an expert. So let me introduce you to Dr. Brajesh Patel, a seasoned medical professional, holds an MBBS degree from Dr. SN Medical College, Jodhpur, and an MD in Skin and Venereal Diseases from RNT Medical College, Udaipur. With 9 years of enriching experience under his belt, he currently serves as a senior medical officer at the esteemed Government District Hospital in Pauta, affiliated with Dr. SN Medical College, Jodhpur. Dr. Patel's dedication to dermatology and venereal diseases is underscored by his commitment to providing comprehensive care and expertise to his patients. Today, we are very privileged to have him with us, and he will be sharing insights on melasma and its management. We extend our heartfelt gratitude to you, Doctor, for joining us. So we welcome you on board.
Thank you, ma'am, for giving this such a great opportunity to me.
Thank you, sir. And without further ado, I would like to kickstart the session.
Okay, please go.
Sir, I want to start the session by asking you a very prominent and a very important question which comes in everybody's mind, that what exactly is melasma?
Melasma is basically acquired hypermelanosis, mainly affecting the sun-exposed area of the face and rarely extra facial sites.
Okay. Sir, how
Most
can
commonly,
melasma... Yeah, please continue.
Mostly, this is facial sites are more common in the females as compared to males, and in females also reproductive age group.
Okay. So, sir, why so कि only females are contracted more to the melasma? Why is it?
Melasma as such is a multifactorial disorder, but hormonal influences are more. Melasma is more affected by hormonal influences like estrogen and progesterone.
Okay, all right.
It's more common.
Okay, so what are the causes of melasma? क्या ऐसी चीजें हैं जिससे melasma is quickly exsiculated?
Exact etiopathogenesis is not clear, but it is influenced by environmental factor, genetic factors, hormonal factors, drugs, chronic sun exposure, etc.
Okay, sir, melasma and hyperpigmentation के बीच में क्या difference है? What are the main major reasons of the differences between these two diseases?
Hyperpigmentation is a broad term. Melasma is a type of hyperpigmentation.
Okay.
Which more mainly on the sun exposed area of the face, but hyperpigmentation may be any sites. Like hyperpigmentation due to drugs, hyperpigmentation due to post acne, reals melanosis, many other causes also.
All right. So what are the symptoms of hyperpigmentation and what are the symptoms of melasma which makes them two separate from each other?
Melasma is mostly a clinical diagnosis, but it may be a specific site like forehead, malar area of the face, nose, chin, these are the common site of melasma. But hyperpigmentation due to other causes may be due to cause specific area. Like if hyperpigmentation is due to acne, then it will be acne prone area. If due to contact dermatitis, then there will be affected by the site
Okay.
where the contact allergen is in contact.
Okay.
Any other site may be involved.
Okay. All right. And in melasma, only the face part is involved, you said.
Mostly
Okay.
face, extra male facial site is very common.
Okay. Got it, sir. Sir, are there any signs and symptoms of melasma which are more common, which we can let all our viewers know?
Melasma is a dark, light to dark brown pigmentation of the face, and these are the macular process.
Okay.
Other hyperpigmentation may be linear, straight, whorled, like other patterns.
Hmm.
Melasma is blotches or patches,
Okay.
dark, light brown to dark brown patches.
Okay. And sir, what are
Mostly
the risks?
symmetrical.
Okay. Got it. So, what are the risk factors and risks involved in melasma?
Risk factor involved are genetic factor, positive family history, any drug intakes, hormonal influences like pregnancy, OCP, hormonal replacement therapy, pregnancy, and endocrinal cause. May be more chance in thyroid patients and chronic sun exposure like UVA, UVB, and heat and visible light can also place melasma.
Okay. Sir, I would also like to ask you the questions which our viewers are asking because many people might have a notion, preconceived doubt regarding melasma. So let's one by one also answer all the questions which our viewers have today. One question which has come up is, can melasma be completely cured?
Response to melasma varies person to persons. We
Okay.
can not surely say 100% will be cured and will never recurrence.
Okay.
Recurrences are more frequent.
Okay. So you
So
mentioned that the risk.
clearly we cannot say 100% cured.
Okay, all right. So as you mentioned that it is not 100% cured, and you also mentioned that there is a genetic or a hereditary
Yes,
past.
sir.
So if a person's family history, say her mother or her father has melasma, so is it possible to be passed on the child in the future?
Exact genetic pattern is not clear, but
Okay.
more chances if patient have family history of melasma.
Okay. So it can be transferred to person. So one more question from our viewers, Preeti, is what is the role of glycolic acid in melasma treated?
Which acid, ma'am? Kojic
Glycolic
acid.
acid, yes.
Kojic.
It's glycolic acid, sir. In the chat, you might know it better. What difference does it make?
Glycolic acid.
Yes, sir.
It is depigmenting agent used as a second line therapy in the melasma treatment.
Okay. So what role does this acid play? Does it make it worse, or like what? How it is helpful to
Ma'am,
a
it
patient?
is mainly useful in epidermal melasma,
Okay.
superficial dermatitis.
Okay.
Is a
Got it.
chemical pain like.
Sir, how do you diagnose melasma? That how do you know in a day-to-day life that you have contacted this skin infection? What difference does it make? How a person actually diagnoses it or knows about melasma at first?
Melasma is a mostly clinical diagnosis, as we
Okay.
see routine patient in daily life. So it is
Okay.
easily diagnosed by the looking the hyperpigment face and
Okay.
site of face involved, and pigmentation is mainly light to brown, dark brown.
Okay.
Other pigmentation may be like gray, which is more common in the dermal melasma.
Okay. So, sir, people with entirely white skin can also contact melasma?
Less chances, more common in skin type third, fourth, fifth, which is also
Okay.
more prone to tanning.
Okay. So light to dark brown is the whole thing
Yes.
about that. Got it. So, sir, how do you treat if a person has recently been diagnosed with melasma? So, how do you usually treat melasma?
I usually start with first I advise patient to take sun protective behaviors like regular use of sunscreen, avoid sun exposure,
Okay.
and then I advise usually first line I advise triple combination therapy
Okay.
for a few days, and then I start maintenance therapy like retinoids, azelaic acids,
Okay.
and regular use of sunscreen.
Okay. Sir, you mentioned about a therapy. Can you please guide us more about that?
Which therapy, ma'am? Ma'am, first line therapy is triple combination. First
Yes.
triple combination therapy like
Okay.
Kligman या modified Kligman formula.
Okay.
For 2 to 4 weeks, I advise this therapy, and then shift to non-hydroquinone derivative like the azelaic acids, retinoic acids, glycolic acid. These are the first line therapy.
Okay. Sir, which are the
Usually,
sunscreen?
that's for patient respond to triple combination therapy.
Okay. So, which are the sunscreens which are helpful for day-to-day lives to apply to avoid contacted melasma?
I usually advise broad spectrum antibiotics more than 50 SPF.
Okay, got it. Sir, one question from Meenal from our viewers here is with me that how can one build a daily skincare routine for managing melasma? To take care of their skin, what should they do to not get melasma?
हम्म, ऐसा कुछ नहीं कह सकता कि मिलाजमा रोग बिल्कुल 100% नहीं होगा, ऐसा नहीं हो सकता है, बिकॉज इट इज मल्टी फैक्टोरियल. तो एक कंडीशन को अपन प्रिवेंट करके मिलाजमा को नहीं रोक सकते, बट वी यूज रेगुलर सनस्क्रीन.
Okay.
Every 2 to 4 hours, regular use of sunscreen. Then chances will be less.
Definitely. So, sir, during the day, sunscreen should be used. During evening time also, they should use the sunscreen.
Ma'am, indoor activities, sunscreen is also advised as
Okay.
UVA radiation can penetrate windows also. So the sunscreen is not only used when going outside, but it is
Okay.
used also inside activity.
Okay.
Every
Got
2 to 4 hours.
Okay. Sir, as we were speaking about sunscreen and as we are speaking about the topic of skincare, that how do we not get melasma? So, what would you suggest to the people that how they can generally prevent melasma as a disease?
मिलाजमा नहीं हो ऐसा तो हम कुछ है नहीं कि इसको अपन बिल्कुल भी नहीं डेवलप नहीं हो, ऐसा तो नहीं, कुछ नहीं कर सकते. वो
Definitely.
अगर उसकी टेंडेंसी होगी, फैमिली हिस्ट्री होगी, जेनेटिक प्रीडिस्पोजिशन होगा तो थोड़ा बहुत डेवलप होगा.
डेफिनेटली सर, जैसे कि आपने बताया इंटायरली नहीं प्रिवेंट कर सकते, बट कुछ चीजें हैं जैसे सनस्क्रीन एंड स्किन केयर जैसी चीजें हम यूज कर सकते हैं ताकि डेफिनेटली वी कैन टेक केयर ऑफ द स्किन इन अ बेटर वे, राइट?
यस.
एंड सर देयर आर सम मिस इन्फॉर्मेशन अबाउट मेलाज्मा एंड हाइपर पिगमेंटेशन. अक्सर लोग कंफ्यूज कर जाते हैं इन दोनों चीजों को, मेलाज्मा और हाइपर पिगमेंटेशन को टुगेदर. So, sir, one करके please हमें guide कीजिए that what exactly is the difference between the two.
मैम, जैसे पहले बताया कि हाइपर पिगमेंटेशन एक ब्रॉड टर्म है और मिलाजमा इज ए पार्ट ऑफ हाइपर पिगमेंटेशन.
Okay, got it.
हाइपर पिगमेंटेशन कैन इन्वॉल्व एनी बॉडी साइट्स, बट मिलाजमा यूजुअली इन्वॉल्व्स द सन एक्सपोज्ड एरिया ऑफ द फेस.
Okay.
एंड अभी सबसे पहले ये पता लगाने का हाइपर पिगमेंटेशन हो रहा है तो उसका कॉज क्या है, लाइक कॉन्टैक्ट डर्मेटाइटिस, डील्स, मेलानोसिस. तो हम उसको सबसे पहले उनको अवॉइड करने का बोलेंगे, ठीक है. और फेस पे है तो मिलेनियम क्लियर दिख जाता है कि ये फोरहेड हो गया, ये चिक्स हो गया, टिप्स ऑफ नोज पे हो गया, चिन पे हो गया. दीज आर द मिलाजमा.
Okay. Sir, Abhishek from our viewers is asking, can oral medications help in treating the melasma?
Yes, oral medication helps. And recently we are using oral tranexamic acid and vitamin C
Okay.
with good results.
All right. So, sir, are any such things that especially from the oral medications, can help treat melasma overall better?
Oral tranexamic acid is a thrombin activation inhibitor. Thrombin
Okay.
activates melanogenesis. So it will inhibit thrombin activation that leads to improvement in the melasma.
Okay, got it. Sir, my next question to you would be, can melasma turns into cancer? Is it possible?
Mm, not reported, ma'am.
Okay, all right. Till date, it is not reported, and it is no fear that it is just a
But
skin condition, is what you would like to say.
benign
Okay,
condition.
all right. Sir, is melasma also due to an allergy or infection? We were talking about sun exposure, we were talking about sunscreen, but family history के अलावा कोई allergy या infection हो सकती है जिसके द्वारा melasma can be a problem or can occur?
मिलाजमा तो नहीं हो सकता मैम. हाइपर पिगमेंटेशन हो सकता है, इन्फेक्शन लाइक चिकनगुनिया फीवर which causes
Okay,
pigmentation of the nose
okay,
and any contact allergens like fragrances.
okay,
Sunscreen also can excessive use of sunscreen can also cause big hyperpigmentation,
okay,
and excessive use of hydroquinone also causes ochronosis. So
okay,
these are the hyperpigmentation, non melasma.
okay. Sir, as we were discussing, that can melasma be permanently cured? Is there any permanent solution that melasma entirely can go away from the skin?
Ma'am, patient will require on maintenance therapy
Okay. So,
on
sir,
and
it
off.
is sir, it is a permanent skin condition.
Yes,
Okay.
can be cured can be cured, but we cannot say 100% will be cured.
Okay. Sir, any self-medication or any self-practice, home remedies or anything a person should maintain or do to prevent it at home? If a person has still not
No,
contacted melasma, so what should he or she do as a care therapy for themselves?
ma'am, regular use of moisturizer and sunscreen. No
Okay.
other self medication is required.
Okay, definitely. So one thing which Dr. Brajesh has told all of us, all our lovely viewers, that definitely whenever you are going out or whenever you are at home also, do not miss your skincare, which is the moisturizer and the sunscreen. It definitely helps to treat melasma better and definitely helps to prevent melasma as a skin condition. So any other take home away message to all our viewers?
Take home message, ma'am, regular use of sunscreen, avoid chronic sun exposure, and regular use of moisturizer. These are the factor required.
Okay. And sir, from our viewers, Yash is asking one very interesting question, that can stress trigger or worsen melasma?
Yes,
Because
stress can
day-to-day
also
life mein stress and tension is a very important thing that is hindering us from doing our day-to-day work. So can stress
yes,
be a factor?
yes, ma'am. Stress can be an important factor in triggering melasma, as stress induces free radicals, which induce melanogenesis.
Okay. So can you please tell us more about the conditions of stress, how it can like escalate melasma as a problem?
It inducible nitrogen oxide free radicals induces lipid peroxidation of cellular membranes
Okay.
that induces melanogenesis.
Okay, got it, sir. So next question from Pooja, our viewer is asking, what are the best topical creams for melasma?
There is no best topical creams. We
Okay,
can't say this is superior, this is inferior.
okay. Sir, so if there are not the best creams, what would you suggest to the viewers? What should they apply and how should they treat it?
And depending upon melasma severity,
Okay,
it is mild, then sunscreen is sufficient. If
all right.
it is severe or less severe, then oral medication and topical non-hydroquinone derivative we can maintain on this.
Okay, all
Like that,
right.
retinol acid, azelaic acid, glycolic acids. If very severe, then lasers like non-fractional CO2 laser can also be used.
Okay,
IPL can be used, but all these are temporary measures. No one is permanently curing.
okay. All right. So my question in the same series to you would be, can melasma be treated with light therapy also? Is it
Yes,
true?
ma'am. Yes, ma'am.
So sir,
Intense
how
pulse
that
effect.
functions?
Ma'am, I am not using light therapy in
Okay.
my daily practice, but intense pulse light and fractional CO2 lasers is used nowadays.
All right. Sir, if the people has like the women in day-to-day lives who have great exposure to sun out there and have contracted melasma, so what should be the first thing that a patient should do when she or he sees that they have contacted melasma?
Ma'am, first light therapy is I start with triple combination therapy.
Okay.
Hydroquinone derivative.
All right. So got it. So next question, what is the impact of pollution on melasma?
There's no direct relation with pollution and melasma because it is a maybe genetic condition. But it yes, it may be affected by pollutions
Okay.
like environmental factor.
So the pollution and sun exposure, all these would be considered as environmental factors which can, in day-to-day lives, can generally risk the skin. So whenever going out, what are precautions one can take? They can cover their face, they can take a scarf, or what all things a person should do when going out.
Cover the face and apply broad spectrum sunscreen.
Okay. All right. So sunscreen is a must. Without sunscreen, I don't think so anybody should step out. And definitely due to such heat and summers right now, everywhere, sunscreen and a good moisturizer should be must. And definitely a broad spectrum SPF at least 50 sunscreens are must. Sir, does diet also play a vital role in this? Dietary guidelines or fluid intake or any such things?
They It may play but no direct role.
Okay. सर जैसे हम सनस्क्रीन की बात कर रहे थे तो सनस्क्रीन विद इन द डे ड्यूरिंग द डे आवर्स वी स्पोक दैट वी शुड डेफिनेटली अप्लाई सनस्क्रीन whenever going out definitely due to whenever we are indoors also sunscreen plays a vital role but we should apply sunscreen overnight also.
Yes, we can apply overnight also, ma'am. But
Okay.
when going high radiation time like 10 to 2 yeah 3 o'clock, then sunscreen is must.
Sir, how sunscreen helps us? Like what exactly is the main reason that we should apply sunscreen at the night also?
Sunscreen, ma'am, may be physical or chemical. Recently,
Okay.
we are using broad spectrum, both physical and chemical sunscreen.
Okay. All right.
So, like a barrier to sun rays reaching the skin.
Okay. Sir, what can we build as a sun skincare routine? हम क्या सारी चीजें कर सकते हैं for our skin for managing melasma?
फेस को अच्छे से क्लीन करना, रेगुलर मॉइस्चराइजर अप्लाई करना एंड सनस्क्रीन के अलावा मैम जैसे रेटिनोइक एसिड पे अपन रेगुलर यूज कर सकते हैं नाइट में, डे में मॉइस्चराइजर यूज कर लिया
Okay.
तो ये पे सब।
Okay. सर अभी रिसेंटली इतने सारे ब्रॉड स्पेक्ट्रम सनस्क्रीन्स और स्किन केयर प्रोडक्ट्स मार्केट में अवेलेबल हैं, सारे सीरम्स और एसिड्स और ये सब कुछ, तो इन सब चीजों से भी क्या कुछ साइड इफेक्ट, कुछ ऐसी चीजें हैं जिनसे कोई साइड इफेक्ट से
मैम
मेलास्मा हो सकता है?
स्किन मैम हर एक की स्किन अलग अलग होती है, किसी की स्किन सेंसिटिव ज्यादा सेंसिटिव हो सकता है, तो ये सब डर्मेटोलॉजिस्ट की एडवाइस से अप्लाई करना चाहिए, सेल्फ एडवाइस सेल्फ अप्लाई नहीं करना।
ओके सर, कुछ नेचुरल रेमेडीज हैं फॉर melasma? आर देयर एनी नेचुरल रेमेडीज व्हिच अ पर्सन कैन डू एट होम टू ट्रीट melasma better, or should they directly come to a dermat and list their queries and get the solution to it?
मैम पेशेंट खुद घर पे जैसे मैम अप्लाई स्टेरॉइड अप्लाई करके आ जाते हैं, कुछ हल्दी अप्लाई करके आ जाते हैं, और सेल्फ रेमेडीज एरिया टू एरिया वेरीज करती है मैम।
ओके सर, जैसे हम बताते हैं किसी को, रिलेटिव को, फ्रेंड को, दैट दे हैव अकर्ड melasma, they have contacted melasma, तो दे डेफिनेटली यूजुअली यूज नेचुरल रेमेडीज, जैसे आपने भी बताया कुछ हल्दी
हल्दी
अप्लाई
अप्लाई
करते हैं आप, बहुत सारी चीजें हैं, तो क्या ये सर करना चाहिए? इज इट हेल्पफुल? इज इट नॉट हेल्पफुल? हाउ डू वी गेट अ
मैम
सोल्यूशन टू दैट?
अप्लाई नहीं करना चाहिए मैम, एक्सपर्ट डर्मेटोलॉजिस्ट से ट्रीटमेंट करवाना चाहिए, बिकॉज दे कैन कॉज सीवियर एलर्जिक रिएक्शन आल्सो मैम।
ओके सर, ऐसे कुछ केसेस अभी रिसेंटली अगर आप शेयर कर सकते हैं कोई भी एग्जांपल जो नेचुरल रेमेडीज या किसी भी रेमेडीज से डायरेक्टली बढ़ गया हो, वो अगर आप शेयर करना चाहें तो डेफिनेटली यू कैन।
रेमेडीज से तो नहीं आता मैम, स्टेरॉइड जो पोटेंट स्टेरॉइड यूज के बहुत सारे केसेस आते हैं मैम,
ओके
especially in the peripheral villaging area, patients are using a potent steroid for chronic periods. Then
ओके
present to us with a TSDF like cases, which is difficult to treat then.
ओके गॉट इट। सर, आर देयर एनी फिजिकल वर्कआउट एक्सरसाइजेस जो हेल्प करती है हमें स्किन को हेल्दी और बेटर रखने में, सो दैट वी डू नॉट कॉन्टैक्ट मेलाज्मा इन द कमिंग फ्यूचर?
एक्सरसाइज तो मैम वैसे भी पूरी बॉडी को हेल्दी रखती है, तो स्किन को नो डाउट हेल्दी रखती है। स्किन में
डेफिनेटली एक्सरसाइजेस एंड वाटर इनटेक सर, जैसे आपने बताया।
स्किन में हाइड्रेशन मेंटेन रखना जरूरी होता है मैम।
सो एक्सरसाइजेस एंड वाटर इनटेक एंड मॉइस्चराइजर एंड सनस्क्रीन, ये कुछ चीजें हैं जिनसे हम डेफिनेटली आई गेस मेलाज्मा प्रिवेंट भी कर सकते हैं, वी कैन कीप आवर स्किन डेफिनेटली हेल्दी ऑल्सो। सर, ड्यूरिंग प्रेगनेंसी ऑल्सो कुछ फीमेल्स में क्या मेलाज्मा देखा गया है, या प्रेगनेंसी के दौरान इट इज अ हाई रिस्क ऑफ कॉन्टैक्टेड मेलाज्मा?
यस मैम, फीमेल्स में मिलाजमा मोस्टली में डेवलप ही प्रेगनेंसी के टाइम होता है मैम,
ओके ऑलराइट।
ड्यू टू
सर, इसका कुछ स्पेसिफिक कारण?
मैम हार्मोनल ले होता है, प्रोजेस्टेरॉन एंड एस्ट्रोजन मोर इन लेवल इंक्रीज ड्यूरिंग प्रेगनेंसी।
ओके सर, हाउ कैन वी मैनेज दैट ड्यूरिंग प्रेगनेंसी?
Regular use of sunscreen and ma'am some topical treatment we can use in pregnancy, like azelaic acid we can use in during pregnancy, and regular use of sunscreen and moisturizer.
So during pregnancy also, a woman should daily apply moisturizer and can manage it.
Yes.
So your message to the viewers and patients who have recently been undergoing melasma or are in chronic stress, that how they should get the better treatment or how they can treat themselves.
Yes. Avoid sun exposure, regular use of sunscreen, moisturizer, what full water intake, good liquid intake, and good skin cleansing. These are the main key factors.
Okay, sir, and how do men should get their skin care routine in time?
Men should also apply sunscreen, moisturizer, skin cleansing, liquid intake. This applied on both males and females.
Okay, and as we discussed in the introduction that only 10% of the males are attracting it and the females are attracting the melasma more. So what is the major reason behind this ratio difference?
This may be due to hormonal influence, ma'am.
Okay. All
Other
right.
factor may also be involved, but major is hormonal and genetic predisposition.
Okay. All right. So genetics, as you mentioned, that if a parent has it, definitely their child can have it. So sir, अगर किसी की family history है melasma की, तो क्या उन्हें during birth ही they should take some preventive measures कि उन्हें in future melasma ना हो? Is it possible that if there is a family history?
ये पॉसिबल नहीं हो कि बर्थ से ही अपन कुछ न कुछ ट्रीटमेंट कर लेगा, ये नॉट रिक्वायर्ड है मैम।
Okay. All right, sir, got it. Any more question from our viewers? Definitely you can post it up and we would try and answer all your queries. As we were speaking that melasma is not permanently cured, but definitely it can be prevented on day-to-day basis. You can take a very good skincare routine of yourselves, can easily apply sunscreen because sunscreen is a must, and the temperature which is going on right now, I think moisturizer, enough hydration, a very good diet, and taking care of your skin on a day-to-day, on a daily basis is definitely a must. So what do you would like to add, sir? Am I saying the right thing that sunscreen and
Yes,
moisturizer is must
yes,
for all the viewers?
yes, all ma'am.
So thank you so much, doctor, for being on board with us, and definitely this was a very insightful session. So thank you, Dr. Brajesh, for your valuable time. It has been
Thank you,
a
ma'am.
very
Thank you, ma'am. Thank you.
informative session for our viewers. It is great to hear from you. We really look forward for many, many such sessions in the coming future. And thank you for all the viewers who have joined in today for your excellent participation. And stay connected to the beautiful Spotless Skin page. Thank you so much and a
Thank you.
very good day to all of you.